Okay, so we're going to get started talking about the effect of stress and digestion. And this is near and dear to my heart because it's something that I have battled with for a long time. And at the end, I'll show you just a couple test results of some actual clinical patient tests and kind of what things looked like and kind of put the pieces together here. But let me share my screen. So we'll go through the presentation first, and then I'll pull up a couple tests to show you. So the effect of stress on digestion, understanding it, I always feel like this is something that I didn't always stop and think through. And now that it's part of my everyday work that I do with clients, it's hugely important. It's been significantly impactful for me. So just discovering how stress impacts your gut and then talking through some really practical, but also science-backed strategies to improve that. So first, let's talk about the gut-brain connection. And really, your gut is your second brain. I always I tell people all the time, like, I can't believe we don't like study this intently in conventional medicine. It really is discouraging when I think about it. Because it's significant. And every time I read these statistics, I'm reminded, like, goodness gracious, like this is hugely impactful. And we think about, the lifestyles we live now with convenience foods and significant stress and just go, go, go. And both parents work and, all the things. It's no wonder that we are the sickest country really in the world. And our current healthcare structure is not doing a good job addressing this. I don't want to get off on a tangent or I'll never make it through this, but let's just go over some facts. So 100 million neurons is contained in your digestive system. It is like an intricate nervous system and it connects to the brain via the vagus nerve. So they are in constant communication. And vagus nerve we'll talk about later when we're talking about ways to improve these things. Vagus nerve or vagal nerve stimulation will be something that we'll talk about. 95% of serotonin is produced in the gut, and that again blows my mind because goodness gracious, if I told you how many prescriptions for SSRIs or like depression, anxiety medications, even I have been on them over my lifetime. And I'm not saying that there's not a role for medicine, certainly not saying that. But when we think about why are we not producing enough serotonin, we need to look back to the gut. 95% of serotonin is produced in the gut that influence mood and digestive function. So this is what we call the gut-brain axis, and it is a bi-directional pathway. So again, they're communicating all day. And if there's any disruption in this balance between the mental state, it'll disrupt the balance between your mental state and digestive health. You know how we'll say like we have a gut feeling and things like that? This is kind of where that comes from. And some of the toughest clinical cases, I would say, when we look at the labs together, are more nervous system related. In other words, we can look at the gut testing and we can do our best to correct that all day long. But if we don't address the nervous system, a lot of times patients don't get the outcome because it's a huge part. So we have to use those things together. So what happens to digestion under stress? It's definitely a cascade effect. So stress comes in, hits our body, we enter fight or flight, and that actually diverts blood flow away from the digestive system and the stomach to your muscles and vital organs. So this is like primitive survival instinct. And like, our body is always going to prioritize survival over digestion. So all of the blood or a lot of the blood is diverted away from the digestive system to muscles and vital organs. It is a survival response. It reduces stomach acid production, which is hugely important when we're talking about a lot of different chronic diseases. And this is something where the acid reducing medicines like proton pump inhibitors, like Nexium, omeprazole, Prilosec, gosh, again, I wrote prescriptions for that like candy, and I never really understood why am I putting a Band-Aid on something that's actually like supposed to function. Our stomachs are supposed to be acidic. So it reduces stomach acid and digestive enzyme secretion. So your stomach needs to be acidic that sends a signal to your pancreas to release digestive enzymes. And if the stomach isn't acidic and we don't send the digestive enzyme message to the pancreas and we don't release digestive enzymes, it doesn't matter how clean you eat, how much protein you eat, you will not be able to digest and absorb the nutrients that you're eating. That's why we see a lot of long-term side effects from being on acid reducing medicines, increased risk for infection, because our stomach acid actually helps kill things that shouldn't be there. Um, Bone loss, and probably one of the most significant that I would see is iron deficiency anemias, even to the point where patients were needing transfusions for that, which is obviously a big problem. And that severely impairs your body's ability to break down food properly. So we have some of the like more serious effects, but also just like in a kind of daily, what are you going to feel? You're going to feel bloated. And it's not necessarily, a lot of people think it's a food sensitivity. It's not necessarily a food sensitivity or intolerance. It's the fact that when food hits your stomach is not primed to be able to digest and handle, absorbing nutrients, digesting the food properly. That can make you constipated, but it can also, on the other hand, give you diarrhea. It just kind of throws off the whole balance. So some patients will have frequent loose stool, some people will have constipation. The altered gut motility can create uncomfortable symptoms. So you're going to feel this as bloating, cramping, diarrhea, or constipation. It alters your digestive rhythm that becomes disrupted. So stress-induced changes in the microbiome, and this is one of my favorite things to look at because I love doing gut testing and actually looking at the bacteria that's there. Y'all, I am so overwhelmed by all the things that I'm bombarded with on social media, and I'm thinking, I can't imagine how everyone else feels. I mean, at least I have the tools and like I've done testing on myself, I do it with patients, but it's like there is so much out there as far as like what is good and what is bad, and all these blanket statements about this is good for everybody or this is bad for everybody. And it simply doesn't work like that. Everybody is unique and this needs to be a personalized approach. We'll talk about that as we go. But looking at the microbiome will tell us. So, one of the biggest things that we see stress induced changes is decreased diversity. And this is something that I'm going to show you on one of the labs at the end. But chronic stress dramatically decreases or reduces the beneficial gut bacterial populations, and that weakens the microbiome's resilience. So when we look at the microbiome testing, a lot of people always want to look like and say, like, do I have a parasite or do I have yeast or do I have bad bacteria? And they focus on what they want to clean up. But really, we can tell a lot by lack of good bacteria in the gut. And we'll talk about that. I'll show you, and we'll talk about some things that you can do to help that. When we don't have the good stuff growing, guess what that means? It leaves a lot of extra space for harmful growth. And stress creates conditions that favor harmful bacteria and increases intestinal permeability. This is where you'll hear the term leaky gut. That is a less than ideal situation, as that lets a lot of undigested food particles, toxins, things that should not be leaking out into the bloodstream. It allows them out into the bloodstream. And this is where we get a lot of that chronic inflammation, puffy, can't lose weight, mood is disrupted. We get a lot of autoimmune kind of things. And so we definitely want to avoid leaky gut. And then inflammation, the imbalance triggers widespread inflammation. It worsens both the digestive symptoms and mental health conditions. So lots here as far as how stress affects the microbiome. And it really is a vicious cycle. Sometimes I kind of laugh. I'm like, well, gosh, what came first, the chicken or the egg? And every patient is different, every case is different. And I'm not going to say that there's always one thing that's a trigger. It's really a combination of a lot of different things. I tell people like the human body is a spider web, and to think that one area doesn't then have a connection and affect another is really kind of silly to think. Which, I do think in conventional medicine, when patients would come to me complaining of something, if it was above what I could help them with, I was always trying to think, okay, well, what specialist does this person need to see? And it was really frustrating, even in that setting, before I started studying functional medicine and realized that there were so many gaps and needs that weren't being met, that I even just kind of reading the consult notes felt like, gosh, why doesn't the rheumatologist talk to the endocrinologist and put the pieces together? But we've really like compartmentalized every system. And to have someone that will sit down and put it all together, I mean, there's real value in that. And I think we need to get back to that. But chronic stress, persistent stress triggers digestive dysfunction. And then we get things like IBS, GERD would be reflux, and sometimes inflammatory bowel disease. And those conditions worsen with the stress exposure. And then we have increased anxiety, digestive symptoms, heightened mental distress. This is oh my goodness, I haven't been to the bathroom in 3 or 4 days, or I can't leave the house if I don't know where the bathroom is to stop on my way, or avoiding social events, or, planning social events around your bowels. I always feel very passionately that no one should be doing that. And unfortunately, when you go to the doctor and complain about that, it's either we'll take Miralax every day, or here's a prescription to help with irritable bowel, and nobody's really getting to the root of like, well, what's the imbalance here causing all of this? And maybe fixing that will give us a lot better long-term success rather than have us dependent on, laxatives and medications and that sort of thing. So the cycle perpetuates, intensifies. It's just this whole feedback loop. And it is sometimes hard to tell where is it starting? But definitely stress would be one of the triggers at the root that we would want to consider. And that's why the functional medicine model really is sitting down with the patient, writing out the entire timeline and looking at some of these events that kind of lead up to when they felt like their health started deteriorating or some of these symptoms started popping up. So breaking this cycle is essential both for restoring gut and mental health. And understanding the connection empowers you to intervene at multiple points. So I always tell patients, like, I want you to be empowered to know exactly what your body needs for the rest of your life. You don't need me forever. But it really is empowering. So using functional labs, how do we use functional labs to heal the gut stress cycle? So first, we are going to identify root causes. So using the functional testing, I like to do gut microbiome testing. We can look at inflammation markers, look at intestinal permeability levels, and that refers to the leaky gut. We can do the comprehensive stool analysis, like I was saying, some organic acids testing that's looking at nutrient levels. Sometimes food sensitivity panels. I don't always start right off with that. I don't like to do food sensitivity testing in the absence of gut testing. And I think sometimes a lot of functional providers just run a food sensitivity test. And the problem with those tests is like a lot of foods can come up and they can be influenced by foods that you eat a lot. So we really want to take that into consideration with what is happening real time in the gut, and that lets us kind of be more exact with that. And then cortisol testing, looking at cortisol adrenal function, that kind of helps us tell where are things going wrong, what targeted supplements can help support this, what lifestyle interventions, like small habit changes, are going to make a big difference there. So I'm going to show you guys some actual cases, but this is one that just came to mind. I see a lot of patients suffering with irritable bowel syndrome and a lot of I went to the GI doctor and they did a colonoscopy and everything's fine. So they diagnosed me with IBS and sent me on my way. And that is not the end of the story. Like, I want to shout that from the rooftops. So we did comprehensive functional labs on her to identify specific imbalances. And then based on those results, I was able to see, okay, what direct probiotic strains are actually going to be helpful. We can use gut healing nutrients like L-glutamine and things like zinc carnosine, and then always supporting the adrenal system, the nervous system. And really pretty quickly, she experienced significantly reduced bloating, normal bowel movements. I mean, she used to wake up with her stomach extremely bloated, and now like it's a significant difference. And I think sometimes even just giving the patient hope that there is something that hasn't been looked at and there is a different approach. I feel like a lot of times, like, especially when I've struggled with health things in my life, I just want to know that someone understands that I'm not alone and that there is hope. So a personalized approach, and that really is where we get total healing. All right, so let's talk about, now that we've talked about like the significance of the gut-brain connection, how stress does significantly impact our ability to digest and absorb foods. Let's talk about some tips to support digestion and reduce stress. So one thing that I want you to think about is two different areas of the nervous system. So the sympathetic nervous system, meaning the fight or flight, and then the rest and digest. So most of us, just because of how our culture works, we are in fight or flight. This is like rushing woman syndrome or high performing syndrome, or used to years ago, it was like running from the saber-toothed tiger. Well, now we're not doing that, but I always tease my patients and say, an email can be interpreted as a tiger in our brains. So we're constantly bombarded. Our watches are dinging, our phones are dinging, emails are coming in. It's go, 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 social media showing us what life should look like. And it's this endless hustle to have the things that we think, everyone else has. And that right there, even living in that mindset will put you in fight or flight. Okay. So we need to actively turn that system off or at least tone it down. We only need it to kick in when we are in danger, like have a significant stressor that we need to respond to. It doesn't need to be like every email or every post someone posts that we're I don't want like jealous of or thinking, oh, well, she's doing better than me or I need that, that whole thing. And I'm preaching to the choir. This is me. If I talk about things that I struggle with, I know that you guys can relate. Um, so we need to switch from that to rest and digest. And the way we do that is through the vagus nerve. And these things that I have written out here are ways that we can stimulate the vagus nerve to help turn on the parasympathetic rest and digest nervous system. Okay. Deep belly breathing. I love the app called Breathwork. It's the word breath and then WRK. It's not like a big long 20-minute meditation that none of us have time for. You can set it like for 2 to 3 minutes and it'll just guide you through some deep breathing. Okay. So practicing 5 to 10 deep diaphragmatic breaths, and time it with something that you do anyway, like eat or brush your teeth or something like that, taking the dog out. So if you time it with something like eating, I mean, eating is great because then you prime yourself to be able to digest, but this can be beneficial any time of day. Um, and that will activate the parasympathetic rest and digest nervous system mode. Probiotic foods, this doesn't necessarily directly have to do with the vagus nerve, but one of the big food groups that we want to introduce to help support the good bacteria that plays a big role in motility and that sort of thing would be fermented foods like yogurt, kefir, sauerkraut, and kimchi. And you really don't need a large quantity of like the sauerkraut and kimchi. A small, like even just 1 to 2 tablespoons, has significant strains of helpful flora. Mindful eating. So eating slowly, chewing your food thoroughly. I talk a lot about this with the patients that I'm working with one-on-one because we eat on the go, we eat in front of screens, and that all slows our ability to digest food. Remember that digestion starts in your mouth with chewing, and that salivary amylase starts breaking food down. If you do not chew thoroughly, you're going to have a lot harder time breaking down and absorbing and digesting food. Savor your food. This also helps from a behavioral standpoint as far as when am I hungry and when am I full? And those are things that most Americans have totally, I mean, we're totally out of touch with what that even feels like. But that optimizes enzyme release and nutrient absorption. And again, you can be counting macros, you can be eating all your protein. And if you aren't doing these basic things, that's why I see so many women who are in that cycle where they're doing all the things that used to work and then all of a sudden it's not working anymore. And then relaxation techniques, so meditation, yoga, progressive muscle relaxation that helps lower cortisol, supports digestive function. A couple more that I want to add, just in addition to the belly breathing, as far as the vagus nerve. Humming is another way that you can stimulate the vagus nerve because it actually runs through your jaw, and the vibrations from that will help stimulate the vagus nerve. Also, gargling, like pretty forceful gargling, can help do that as well. And then just some general lifestyle habits that are going to support gut health. Sleep. I mean, I always say like sleep is foundational. It is, if sleep is messed up, a lot of other things are going to be messed up. So prioritizing quality sleep aiming for 7 to 9 hours. Engaging in gentle, regular exercise like walking and swimming are great ways to support gut motility and stress resilience. And, I always say like we can't control our stressors, but we can control how we respond to stress. So we need to have a good toolbox and maybe you need to write them down. Maybe you need to write gargle, hum, 5 to 10 deep breaths, take a walk, change your environment. All of those things are going to help just as far as how you handle stress. And we want resilient adrenal systems, which is pretty rare these days. Hydration and nutrition, staying well hydrated, obviously getting lots of nutrient dense foods in, avoiding heavily processed foods that can have a significant impact on the gut microbiome and that ecosystem. Emotional wellness, so doing like mindfulness practices, journaling. I love having patients if they're having trouble sleeping, doing just like a brain dump where they have a small journal beside their bed and you don't even necessarily have to write even complete sentences, but just kind of jot down like what's going through your mind, what's keeping you awake, those racing thoughts, and get them onto paper and then shut the book. Strong social support networks. I talked several weeks ago in the hormone talk about how oxytocin is like the chief hormone that then governs cortisol and insulin and all of the sex hormones. So if we lack connection, that can be a lot of different things. It can be family, it can be church, it can be like groups and support kind of things that you're involved in, like volunteer, that kind of stuff, friends. There's lots of different ways to do that, but we have to have strong social support networks. I mean, the history of humans, we've always needed connection. And I think it's really cool that God made us like that. And then obviously reducing stimulants. I say obviously, because we all, I think, know it. Sometimes a little bit harder to break the habits, but limiting caffeine, especially in the afternoon, reducing screen time at least 1 hour before meals. Did you know that screens actually impair your ability to digest food? And not just because it is distracting and we don't chew thoroughly, but it actually kind of shuts that system off. And I tell the kids this all the time because they love to sit in front of the screens. Not that it's never going to happen, guys. I want to make this really practical. But if you're in a position where you can step away from a screen, it doesn't even necessarily have to be a full hour. That's ideal. But whatever works for you, that can be a small but powerful habit change that's in your best interest. So, how do we break the stress digest cycle? Understanding that the gut brain axis and understanding it empowers you to make informed healing choices every day. If you have personalized labs, this is again where like there's so much information out there and it's overwhelming. But if we've looked at your labs and we have a targeted plan that's going to work for you, that's extremely helpful. It takes the guesswork out. And then adopting simple habits. And that's like what I love is that it's not like, okay, all of a sudden tomorrow I have to totally change everything I'm eating. I have to exercise. I have to like do all these things. No, it's small, simple habits over a period of time that create a lot of long-term benefits. Okay. I was just reading the last sentence down there. Obviously, the gut health is foundational to overall well-being. I'm going to stop my share for just a second and pull up a couple um, tests. Okay, so just a couple things that I want to show you guys. A second, let me get in the right. So these are actual patient test results. So many windows. Okay. All right. So first I want to show you just kind of like when we're looking at the microbiome, a lot of people are like, oh, I don't have anything in the red. That's great. But what's more telling to me here, and this is a patient who has struggled with constipation and that sort of thing. So when we're looking here at the green, these are all the beneficial bacterial families this is the garden, this is the forest, this is what we want growing robustly. So ideally, all of these would be 4 plus. And look how low these numbers are, 2 plus, 1 plus, there is one 4 plus. There's actually no growth of the Enterococcus family. And this is probably one of the biggest things that I see in patients with what do I call chronic constipation. Now remember that the microbiome is really like, I mean, from birth, it's kind of a representation of like birth till this patient was 37. So how you were born, if you were born by a C-section, if you were fed formula, those are all things that are automatically going to start you out with a reduced amount of good bacteria. And then you combine that with chronic stress and poor nutrition. Obviously kind of sets us up for this picture of not a lot of good bacteria growing. And with the imbalance, these are not necessarily benefiting or harming the host. But once we get to more than like 2 of these, we really do consider it a dysbiosis. In other words, there's an imbalance of the amount of good that's growing to the amount of not so good that's growing. And then there was some yeast, which it wasn't high enough to be over in the red, but yeast is not helpful. It can really drive sugar cravings, just feeling like you have less willpower in general. And then I see a lot of skin complaints with yeast. So rashes that won't go away, itching, acne, that sort of thing. Let me scroll down just a little bit. I think I have one other section on this that I wanted to show you guys. So looking at the composition of the microbiome is helpful. And then also on the stool testing, we will look at several other numbers. The ones that I want you to see here are the secretory IgA. This is immune system. This number is high. We don't want it low and we don't want it high. So when it's low, it's letting things come in that shouldn't necessarily be coming in, cancer cells, infection, that sort of thing. But when it's high, that's like an upregulated, almost like an autoimmune type response. That could be in response to the yeast. And it can also just be decreased overall resilience because we don't have a lot of the good stuff growing. And then the short chain fatty acids, you can see some of these are abnormal, and it's kind of hard to understand short chain fatty acids, but basically the good bacteria that's growing in the gut ferments dietary fiber and it produces these short chain fatty acids. And the GI doctors have been saying for quite a while that short chain fatty acids are one of the biggest predictors of colon cancer. So we don't want them to be low. We want them, or high really, we want them right within the middle of the reference interval. So dietary fiber plays a huge role in feeding the good bacteria and also producing these short chain fatty acids. So what we did for this client was put her on a broad spectrum, really high potency probiotic, some herbs to kill off the imbalanced bacteria and the yeast, and then a fiber support that will help support these short chain fatty acids. And let me show you one other stool sample real quick. And this is actually a patient who had really bad acid reflux and had been kind of on and off acid reducing medicines, although she didn't really feel good about continuing to take them long term. But look at digestion absorption. If your stomach, so a lot of times when patients go to the doctor and complain of heartburn, it's actually low stomach acidity, not too much stomach acidity. And what I was taught is if someone comes in complaining of heartburn, we prescribe Prilosec or Nexium because that means there's too much acid and we're trying to turn the acid off. But actually, if the stomach is not acidic and food just sits right here, it can't go on and be digested or any nutrients absorbed. Of course, you're going to have heartburn. Your whole meal is like sitting right up here and it can't go anywhere. So I thought this was a really good picture of a patient with those symptoms who had been prescribed medicines off and on. She wasn't currently on any acid reducing medicine, but this is a stomach acidity problem. She doesn't have enough stomach acid. So when we actually got her stomach more acidic, we can do that through things like pretty potent, like lemon water, apple cider vinegar, and we can even use a supplement called hydrochloric acid that is a stomach acid. And we put in some digestive enzymes to help her pancreas with this number actually be able to digest and absorb nutrients. Her heartburn has gotten significantly better, and she used to have a bowel movement like every 5 days, and now she is like she sent me a message. She's like, "Oh my gosh, I'm not constipated anymore." It's like freedom, hallelujah. So this is significant. This is it's not always this low. This is probably one of the lowest ones I've seen, but optimal is over 500. And when I'm looking at functional labs, I'm not just looking for normal. So the reference interval, like normal's over 200, I want it optimal, and over 500 is optimal. Anything less than that definitely could stand to be supported. And then if you see, because her stomach wasn't very acidic, stomach acidity is one of the first things that kills things in the gut that shouldn't be there. That's why patients on acid blocking medications a lot of times will get things like C. diff and food poisoning and things like that because their stomachs aren't acidic. It can't deal with that. Can't kill it. So her secretory IgA, that immune system number, is on the low side. And we have not done a repeat test for her. We just started working together a couple months ago, but I'll be interested to see when we recheck this if that has come up just as a secondary kind of effect on all the other gut cleanup and actually getting her stomach acid to the right level. Okay, one last one, and then I'm going to wrap this thing up. I want to show you, since we were talking about stress, but those are all things like both of those patients had significant stress, chronic stress, really, high performing females in stressful jobs. And so that chronic stress was there. So when we're looking at things, I typically use Dutch to look at cortisol patterns. And when we have cortisol that starts out this high, I mean, this is like the whole morning is fight or flight. I mean, it's wake up, rush, out the door, kids to school, like, all the things, really high. And then you see it comes back down to normal in the afternoon and night, but still on the higher end of normal. And again, like sometimes that change can really, that's what almost feels like an adrenaline crash. But these levels are not helpful for digestion, for the microbiome. I mean, it's having a direct effect. Now, what I want to direct your attention to is even though these numbers are really high, if you look over here, like the saliva cortisol is high, meaning she's pumping out a lot of cortisol. If you look at the metabolized cortisol, this is like this is the gas in the tank. This is like the total cortisol production. She has done this for so long, she has no gas left in the tank. So this is like trying to put your foot on the gas and like make it through the day, rush, 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 all the things. And your body, I mean, you run out of gas, literally. And so a lot of times we'll see this is like a wired but tired, like mentally exhausted, but still wired, like can't let yourself relax. That's one of the things I love about the Dutch report is that we're able to look at this and even kind of figure out further, okay, what interventions do we need to use for this patient? So we did some morning sunshine, we did some contrast showers, so kind of switching from hot to cold, all the vagus nerve kind of things that I talked about through during the presentation. Then we can use some really targeted herbs like ashwagandha, rhodiola, maca, and strategically plan them at different times of the day just to kind of settle this adrenal response and make it more resilient. And then that also helps the metabolized cortisol come up so that we have some gas in the tank, but we're not slamming our foot on the pedal, all day long, which has a lot of trickle down effects to insulin and the gut and all the things. I think it's so fascinating to put all of the pieces together. That is perfect. It's 11:40. That took me 40 minutes. Any questions before I end this?
No, honestly, I feel like everything was so thorough. I really appreciate it.
Awesome, awesome. Well, you know that you can ask me anything, anytime. Our next live will be in 2 weeks, and I think we're talking about cravings. But I want to always make sure that we're doing topics that are pertinent and helpful for you. So if anyone ever has any advice, even if as those of you who are watching the replay, please let me know because I want it to be helpful. Otherwise, it feels like a waste of my time.
Well, this was definitely the topic that I was most looking forward to because it's the one that seems to affect my life the most.
Yeah.
So, thank you.
Yeah. And I feel like stress is such a general term that, I mean, stress, remember, and I'm glad you said that. Remember that stress can be good things. Like exercise puts us into fight or flight. Excitement, like it can be stress, like almost like euphoria, like good things. But we want to make sure that we have those tools and we're practicing them often as far as like how do we settle our nervous systems down and kind of get after those stressors. Like that's normal. It's a part of life. It's a healthy, kind of thing. But then what do we do with that and how do we come down from that? So, all right. Well, thanks for being here, Sarah Ann. I hope you have a great rest of your day.
You too.
Thank you. Bye.